Today, just want to go over some of the issues related to multiple organ dysfunction syndrome, and just talk generally about that. Basically, the primary case of MODS is due to trauma, but there are a lot of secondary things that can lead to multiple organ dysfunction syndrome. Among those are a response to septic shock, systemic inflammatory response syndrome. In the elderly, it can be due to chronic illness. It can be the response to surgery, to malnutrition, or immunosuppression. So there are many different avenues that can lead to multiple organ dysfunction syndrome. Always remembering, of course, that the primary reason for it is some sort of trauma directly to the organ, or that region, to the organs in that region. However, secondarily, it can be the result of all of these other issues related systemically to the body. Now, so the symptoms that show that this is actually taking place are, first, lung dysfunction leading to respiratory issues. A metabolic increase, slight fever, and mental changes are some of the preliminary precursors to indicate that MODS is happening. So basically what's called for, once you start seeing these symptoms and one of these other things is in play, what you do is you address the primary cause, and you need to know what the primary cause is as near as you can tell so that that is being dealt with. Often you can get sidetracked to the secondary thing and dealing with the organs themselves, their dysfunction, when basically there's actually a cause prior to that that needs to be dealt with. So find the primary cause, deal with that, maintain nutrition and tissue perfusion, and recovery is then possible as the body works and the organs take up their normal functions. But you've got to address the primary issue, maintain nutrition and tissue perfusion, and that becomes possible. However, in most cases where MODS occurs, where this multiple organ dysfunction syndrome sets in, 75% of those who have it will gain or move to liver failure, gastrointestinal failure, renal failure, and then ultimately death. So looking for these warning signs, the lung dysfunction is usually the beginning sign, metabolic increase, slight fever, mental changes, and these other things are in play: direct trauma, septic shock, systemic inflammatory response syndrome, chronic illness in the elderly, post-surgery, someone with malnutrition, or someone suffering from immunosuppression. This may be part of the issue. In dealing with it, certainly from a nursing standpoint, it's important to maintain nutrition, tissue perfusion, those sorts of things. And then obviously if the person survives, then there may need to be some education follow-up wise to teach the person how to deal with possible permanent results of having suffered from multiple organ dysfunction syndrome. Anyway, this is just a basic overview of some of the causes, some of the signs that it's of its onset, ways of dealing with it, and then some of the results. If you'd like to learn more, underneath this video there's a link. If you'll click on it, it'll take you to a website that has that information and related information. And at that site, you'll also find a link to an ebook that's ready for immediate download.